Welcome to this new appointment. We are still in the Dysfunctional Vectors episode of Unit 1. Today we will demonstrate the anteroposterior dysfunctional vector of Unit 1. We will initially treat the tissues that go obliquely from the anterior part to the posterior part of the higher dorsal and cervical area, and then transmit the entire dysfunctional chain to the upper limb in the posterior part of the arm, the forearm, the wrist, and the hand. So we start by working the part gently, also because we're dealing with very delicate structures. Let's remember the vascular structures passing through the structures at this level. The idea is to go in under the occiput, move to the level of the mandibular angle, where we find the first cervical transverse process, and try with our fingers to get deep into the tissues, because we know that the anterior-posterior line starts from the anterior area of C1. You can do this in an integrated way with the rotation of the head, and this way, you eventually choose the rib. First, second, third, or fourth. We accumulate parameters on the costovertebral joint, and we have the thrust. At this point, you repeat it and go on with myofascial work. We integrate the articular approach with the myofascial release. Firstly, the scapula. We move a little to mobilize the scapula with manipulating the muscular structures.